by Dr. Amir Sadaula, who is in the field right now, and so his internet connection is not very good. Dr. Sadaula is a wildlife veterinarian working with the National Trust for Nature Conservation in Nepal. He's been based in Chitwan National Park since 2014, and Dr. Sadaula is involved in wildlife rescue and rehabilitation, captive elephant treatment, and wildlife disease research. So we will show the recorded presentation, and then Dr. Sadaula will try to be online to answer your questions. So we'll run the presentation right now, the recorded presentation.
Good afternoon and namaste. Myself, Dr. Amir Sadaula. I'm working as veterinary officer in National Trust for Nature Conservation Biodiversity Conservation Center. This series of webinar organized by Asian Elephant Support in partnership with Live Trust India. Today, as an episode which is organized about the elephant health, I'm presenting about the captive elephant health status in Nepal and the overall scenario we are getting across over here. Telling about the demography of captive elephant in Nepal, we have in government owned, we have around 104 captive elephant. Among them, 57 are based in Chitwan National Park. Similarly, 12 elephant are there in Bardia National Park. In Banker National Park, we have 6 elephant. In Parsa National Park, nearby to the Chitwan National Park, we have 9 captive elephants. Similarly, in Suklafata, we have 9 elephant. In Kositapu, we have wildlife reserve, which is in the eastern part of Nepal. There is 11 captive elephant. These are all governmentally owned elephant. And the interesting thing is, like if you look about the demographic data of few years back and now, we in all of this park now we have the young calf. They are each of them has capacity to breed and breeding. They have a breeding cow, and every this protected area we have young calf born in our captive setup. Similarly, in privately owned, we have 70 elephant. All of these are based in and around Chitwan National Park, and all of these are owned by the privately owned hotels who who like among them now we have now these elephant also have capability. They are some of them are also breeding and giving birth to the young calf. Similarly, if we talk about the use of the elephant in Nepal, generally the elephant are used for the park patrolling, like they are used for the um, used for patrolling, like for are used by the army for like anti-poaching patrolling. Similarly, they are some of these elephant they are used for the research activity, like to put on a camera to for a rhino census and all of these things. These elephant are used. Similarly, elephant has very important role in wildlife rescue and treatment. Similar when we go for the rescue of the tiger in very unknown area inside the park or in the forest, we are not able to perform the work without the presence of the elephant. These are the very important thing we need during a rescue. In this two photo, you could see the use of the captive elephant for the treatment of the rhino. Similarly, the treatment of the rescue of the tiger. And similarly, these most of the governmentally owned elephant are used for the park patrolling, research activity, and rescue. Similarly, the elephant owned by the private owners, they are basically used for the ecotourism activity, like rescuing, like for the safari to the forest where the vehicle could not reach over there. Now I want to talk about the major health problem which we encounter in our uh, basic major health problem we encounter in our elephant in Nepal. The tuberculosis is one of the most important and important disease which affect our elephant, and this account for most death of the captive elephant in Nepal recently and in past as well. If you look on the history of the tuberculosis, the first case of the tuberculosis was reported in the patrolling bull in 2002, and we thought that this is the exceptional case, and then uh, we got second case in 2004. When we get the two case regularly, it's an alarming thing, and we need to address this issue. So with the effort of local university, like we have a university in Nepal with the veterinary schools, the student from there and some of the foreign student from US, we both of us collaborate and uh, able to we collaborate and we run a comprehensive elephant tuberculosis survey through which we identify the possible elephant which could be the we identified the elephant, and we started treating this elephant from 2008, and several elephant was benefited through this program. Like if you look on the elephant tuberculosis survey which had happened in 2006, and then it was the first comprehensive elephant TB survey carried out in Nepal. It was carried out all over in Asia, where we collected the trunk wash and collected the and run culture. Similarly, we have done the stack pack test, Mapia test, and we also run the ELISA test for the tuberculosis. And also we look on the CBC, CBC and biochemistry, how the change is happening in blood count and biochemistry of the elephant. These are some of the known elephant dead case caused by the tuberculosis. We can see on the data there are the few cases, two cases in 2002, the Mahendra Gaj, and 2004, the Prem Kale. These are the first two cases which alarm us about the tuberculosis, and there was a wave of death till 2013. Then after, we do not have much mortality. We have most mortality was happening till 2013, and we have a breakage of 6 years. It might be due to the treatment we carried out, we regularly monitor the elephant with the tuberculosis and do the treatment. So the mortality might have decreased over there, but recently, since 2019, there is a again second wave of mortality is happening, where when some of the like elephant died, we do the postmortem, we see the tuberculosis lesion, and from culture we have found that these animal are having tuberculosis. These are some of the examples of the TB cases which were seen in Nepal. These are the two elephant and the lungs of these elephant, where we can clearly see the TB lesions in them. These are some of the elephant. And recently, we have published about the epidemiology and molecular characterization of the Mycobacterium tuberculosis, and including if they have any drug resistance association or not. These are the animal which was the elephant which was died between 2019 to 2022, and we have looked on the epidemiology and their molecular characterization of tuberculosis. Similarly, the one study we carried out in Nepal in 2018, 19, 20, where we look on the where we look on the molecular characterization of the two cases of the tuberculosis dead during that period of the time. which show that the tuberculosis associated with our elephant, the one in the red and another red, these are the two cases of the tuberculosis which we see in Nepal. These are, one case was in lineage 1 and another case was in lineage 2. These are the tuberculosis lineage we have seen in Nepal, we have found in Nepal, and it is more associated and which is more closely related with human. So we could tell that there is a chance that there might be a cross transmission is right. There could be a transmission of tuberculosis between human and elephant, and similarly between elephant and human. Similarly, in Nepal, we endorsed the first action plan. It was called as Nepal Elephant Tuberculosis Control and Management Action Plan, which was endorsed by the Ministry of Forest and Conservation of Nepal, and where the goal of this action plan was to prevent tuberculosis transmission to the wild by controlling TB at the captive wild interface, because the captive elephant is the one of the entities which which is regularly engaged in the captive and wild interface, and they have tendency to transmit the disease from captive to the wildlife. So we addressed that issue so that tuberculosis could not transmit to the wild. Similarly, during 2006 to 2017, we tested around 254 elephant, and 61 elephant was treated during that period of time, where 17 governmentally owned, 41 privately owned, and 3 NTNC owned elephant was treated with tuberculosis treatment. And basically there is still controversy whether there is like tuberculosis will it's good to treat the elephant or not, whether it what the drugs, there is a lots of side effect of the drugs, and even we are very much unaware what happened when we do the TB treatment in the elephant. But basically this photo will show that whether we don't know, whether we'll know the elephant will the TB will completely heal or not. The thing is, it will extend the life of the elephant. This is the example of one elephant. This photograph on the top was from June 2011. It was before treatment, and if you it is the another one is around 2019. There is a considerable change in the like in the overall physical appearance of the elephant, and it extends the life of that elephant. Why TB is important? Like TB is important in Nepal because like if captive elephant are infected with the TB, they are generally used for the ecotourism. There is a chance that this elephant will transmit the infection to the rhinoceros, as this is shown in the photo. There is a chance it will transmit the disease to rhinoceros. Similarly, the breeding of our elephant is carried out by the wild bull. The wild bull come and breed with our female, so the chance that this bull can transmit the disease to the like to the wild population. And similarly, as there is a close interaction between human and elephant, there is a chance that the disease can transmit to the local people. And similarly, we can see the elephant and local cattle are livestock are grazing together. The chance the transmission might happen between elephant and livestock as well. So these are some of the photographs how the elephant is closely associated with the human, and the transmission can happen to the public as well, and it's a very important public health issue. So we also reported the tuberculosis in wild rhino. It's Mycobacterium oryx associated tuberculosis, which is somewhat similar to the tuberculosis in the elephant. So there is a chance that tuberculosis might have been transmitted from like from elephant to rhino. It could be a possibility on that aspect as well. So another important disease we come across in our elephant is elephant endotheliotropic herpes virus. So everybody knows about the impact of this disease globally as well in our range country. In Nepal, till now we have got 13 cases. Like if you look on the overall demography of the cases, like we have the green one is the one we able to save with our treatment protocol developed here, and most of the if you look on recently there is a huge wave of infection going on in Bordia National Park, and many calf are dying over there. And like in Chitwan National Park, in our breeding center, we have till now 80 calf has born over there, but we have got only three case of herpes ESV virus in our breeding center. So it's very important to know about the cross immunity happening in the group. So it would be a good place to study about that aspect. And interestingly, since 2019, we do not have got any cases now. So we cannot tell that it has completely stumped out, but somehow we do not have got a infection. But most infection has happened between 2015 to 2019. In this 5 years period, we have got around 9 cases of EESB. So these are some of the cases we have seen in our elephant. So we have developed a treatment regime in Nepal, which we generally use the famciclovir like 12 mg per kg body weight. This is the first case where we use all of the case we use the per rectal, but we can like if the elephant feed orally, it's easier. But if they do not feed, we can give per rectally QID for 2 days. It's per and TID for next 2 days and BID for remaining 17 days. We do the treatment for complete 21 days. We can give rectally as well orally, but one the treatment we followed here was one case, like most of the case we have done rectally, and one case we have done oral treatment. Similarly, we give NSAIDs, meloxicam, 0.6 mg per kg body weight, IV for 5 days. And first one we have given the fluid therapy in one cases, but generally I do not prefer to give a fluid therapy because when we give too much of it's my way of treatment. It could be controversial from other, but I generally do not prefer the IV fluid therapy, but better to give rectal fluid therapy, give plenty of the water to the elephant calf, and just motivate the elephant calf to drink lots of water. This way we can do, but and also we give the antibiotic. One cases where we give too much of fluid, it developed the edema on the neck area, and the elephant calf was unable to respirate. So we have to give the diuretics, and it helped to normalize the calf. But with my experience, I can tell that it's better to give the rectal plenty of the rectal fluid and put water inside just in front of the calf and motivate the calf to drink that water. So, and if the calf take a water, we generally do what we do is one of our mahout will be together with the calf when they are infected with ESB, and they just when the calf start to pull the water with the tongue, take with the support assist of mouth, put that trunk inside the mouth, elephant mouth, so that they can drink the water. Similarly, these are the first survived case we from our treatment protocol. This is the first day. Second day, it has developed the clear ESB symptoms with the mandibular swelling and the cyanotic of the tongue. And in third day, it was the neck. Its neck was swollen and it was unable to urinate. Then after, when we give like diuretics is urinated and it's get better in fourth day, fifth day, it start to get back to the normal way, but we still continue the treatment for 21 days. Another important, most important, I think globally, it's a most important problem with the elephant, the captive elephant or working elephant is the food affection, or even the zoo elephant. Food affection is the big issue. Generally, the some of the food affection we could see the overgrown pad, overgrown nail and pads, and osteomyelitis. Similarly, fungal infection. Generally, our our climate is very much tropical, and we have got a lot of rainfall, and uh, our monsoon is very rainy. So we got so many we got so much rainfall that mm, our place will be very like swaggy or swampy, so that the elephant get fungal infection through that process. We have found many cases of this type of fungal infection in our elephant. So we have got a cracked nail, cracked front nail, split nail, and these are the different scenario we could see in the food affection we see in our elephant here. And what we do is we try to address that problem since the last 3 years. Now, we generally do the regular nail trimming and foot trimming work, but with the support of Cathy Adamson Conservation Fund and MacLear International Consulting, we get a international export service about the foot affection. So every November we run like a 3 week health camp, annual health camp to our with our elephant, where we look on the most of the foot affection, and some of our zoo vet from states, they come here and help us looking on the different health condition, and uh, support us through this program. And the good thing about this project, this program is our owner, the elephant owner, they are sensitized about the importance of the food, important about the shade they have for the betterment and better health of their elephant, especially their food problems and this type of the things. So we do the nail trimming, and like we maintain all the cracks, and we try to put on a better hygiene of our elephant nail. And very important, this is the one of the landmark case of this elephant health camp. Like we were very much, this elephant has this food problem, this sort of food problem like granulation tissues and this problem since last 20 years. And with the support of McLaren International Consulting, Mike, we try to address this issue. And and he we this is the support of the international collab, this is the result of the international collaboration we carried out, international support and international collaboration. We started with Mike and our regular interaction. We think about doing the CO2 therapy to this food. Then this is a change we have seen on this food in just 15 days. So we plan to do this continuous treatment for more than 2 3 months, and look on how the change is happening. And the Mahut this so this will be the one of the landmark case, especially to address some of the very worst food problem which we were not able to treat since last 20 years. So it is the benefit of international collaboration and health camp we are carrying out. Similarly, the parasitic infestation is one of the major problem. Like we have uh, endoparasite. Generally, Strongylos is the common endoparasite we have. Like generally, our elephant, when they have the parasitic infestation, we have seen a problem that they have tendency to eat more. When they have a stomach problem, they eat more, and many time we come across the case of impaction and colic through parasitic infestation, but generally in every alternatively we do the treatment of fenbendazole for nematodes, and for the for lice we give ivermectin, and for fasciola we generally give the tricalbendazole treatment. In in annual health camp we generally give we treat the elephant with anti-parasitic medication also. So one of the other another important cases we came across in our elephant is stomach bot also. Generally this stomach bot we generally find out in our elephant after monsoon, generally during November, and November, October, November, our elephant came across the stomach bot condition, and they just stop eating. So we have a great problem identifying this infection as well, but we try to solve it with the ivermectin, and ivermectin treatment, and it was very much successful. So colic is another condition. Generally, our elephant, when they get this stomach infection, no parasitic infestation, and also when they feed mud, they came across with impact, and they have a colic. The symptoms of colic is frequently lying down, getting up, and frequent urination, lifting up hind leg, and resting or leaning against the wall, and they generally bite the tip of the tongue, and just produce the special vocalization when there is a pain, and we give hyacinth butyl bromide for that treatment, for the treatment. But recently we have seen very much a very uh, increase in the case of impaction. Generally, before, when we have the elephant get impaction, we do the treatment, they will solve within 2 3 days. But now we have seen some of our elephant, when they get stomach impaction or intestinal impaction, they have the symptoms, and they do not get healed for more than some of like 10, it takes 10 20 days for complete healing of this infection or impaction. Another important case we have done, I want to share, is about the vestibulotomy we carried out in one of our elephant in, I think it was in March 2023. And this elephant has previously also it has had a dystocia, and we have to pull the calf down. But again, we do not, since our breeding is carried out by the wild elephant, we do not want to breed the elephant, but we get a unwanted pregnancy due to wild elephant. So this was the when the elephant came in the she was in the started parturition, but the calf stopped over here for more than more than 3 4 hours, and we look on the blood profile, and it has uh, calcium deficiency, and we give intravenous calcium therapy, but it did not work. And even we tried to induce the parturition with oxytocin, but it could not happen, and we waited for more than uh, like uh, 8 hours. Then after, we finally decide to do the vestibulotomy, and we clean the vestibular area and give an incision and try to pull this calf towards the vulva, but it was not possible. We could not do that. So we make a big incision over here and pull the calf out. By doing that, we were able to take the calf out, but we do not know the calf was live or not. Luckily, the calf was live. So after about the calf was so exhausted that it takes more than 4 hours to completely the calf could stand up. But the unfortunately, the calf was not accepted by the our dam, and it was not accepted. So when the calf we try to hand feed it, but after a month, it got enteritis and it died. So we could not save it. So this is the post-surgery healing process happening, wound management which was carried out. We try to this is the first day. Second day we try to close the vestibular mucosa with suturing, but it breakage, and we do the second intentional wound healing. So this is on the day 6, and day 18 it looks very good, and this is on the day 90 post surgery. These are the different stage of the different stage of the post surgery wound management. Now, the challenges we came across with the captive elephant is most management in the captive bulls. Like in through our breeding center now, we have got so many captive bulls which born up from our breeding center. Now, the big problem is how we can manage this captive bull. It's a big issue. I don't know how these captive bulls are managed in another range country, but here we are having challenge and doing that stops. And similarly, now we have seen recently 4 cases of dystocia in dam with hypocalcemia. Like they have lower calcium level in late stage of pregnancy, and during parturition they are not able to expel the calf, and we check the calcium, and when we give a bottle of calcium, it just give a birth of a calf. So how we can manage the nutrition of the dam so that the hypocalcemia can be managed will be a very important topic to discuss globally and with other range country as well. So this much from my side. Dhanyabad. Thank you. Any questions? Is
Ranveer active
please any
co-host
questions
active.
which I can address.
Okay. Close panel. Dr. Amir, can you close panel?
Yeah, I'm here, but my network could be a bit I might get disconnect, but I am here. Please.
Oh yeah, okay. Yeah. Thank you so much. Thank you very much, Dr. Amir, for the presentation. In spite of the difficulties, you could able to do it. Thank you so much. We have couple of questions for you. Somebody has asked you which TB species you have found. Any studies which shows TB transmitted from elephant to humans?
The tuberculosis we have found in our captive elephant was Mycobacterium tuberculosis. As we have done the sequencing and alignment of these cases, and we have find out that our tuberculosis was aligned with the lineage 1 and lineage 2, which lineage 1 and lineage 2 of the tuberculosis. And also we have found that this lineage also human also share lineage 1 and lineage 2. We also if lineage 1 and lineage 2 of tuberculosis, most probably with that result we might say that it might have been transmitted from human to elephant, and we don't know whether it could be from elephant to human also. Like our I'm like our publication could not our research could not tell whether it gone from which side, but still it could happen from elephant to human also. As the publication is there, everybody can look on that as well.
Yeah, thank you so much. Dr. Asad has a question for you. Nice information. What are the main signs symptoms of EEHV in elephants?
Generally, if you look on the signs and symptoms, generally, if you look on a textbook, the sign and symptoms of the ESB is the mandibular swelling, cyanotic of the tongue. When we get up to that stage, it is very difficult to save the calf. Generally, we in our case in Nepal, our calf goes to the grazing with their mother. So we trained our mahout that always observe the movement of the calf, whether the calf when they are going to the forest and coming back to the forest, how they are moving, whether they are moving in front of the mother or not, because we have so many calf, all of them, if they run in front of the mother means they are healthy. And if they start to walk together with the mother, then we think that the calf might be sick or they start to become sick. Our mahout help us on identifying the ESB quickly. And also if the calf is just behind the dam when they are coming going to forest or coming back from the forest means this calf, we found that this calf are sick with any sort of problem. So after that we collect the sample, blood sample from the calf and check for the we run a molecular examination. So then after we'll find out whether uh, it has like ESB or not. That with that way we do not go up to the confirmative science, but we look on the other factors. Mahout also help us doing that, and we'll move look on the heart palate. Generally, in initial stage, we found that there is a some sort of ulceration in the heart palate, and in a initial stage of viremia, they generally the calf generally is unable to raise its trunk. So these are when they are just nursing, they are not able to raise their trunk. These are the some of the things we observe, which help us on early diagnosis and saving the calf from this infection.
Yeah, thank you. Next question is from Dr. Ilayaraja Selvaraj. Can you please explain the CO2 therapy for a foot lesion?
I think everybody have seen the photograph of how we treat the uh, uh, like CO2, how we do the CO2 therapy. This is the new technique we try to start in some of our elephant with chronic foot affection. One of the case I have shown with the community is that one has the chronic granulation since last 20 years. It is not getting healed, but some of our international collaboration with Mike McClare is a renowned person on foot affection. We try to do the CO2 therapy. In that, it's very simple. It's not a big issue. Just you put on a big plastic, put the foot inside that plastic bag and give a CO2 therapy just 1 or 2 minutes only. Then you let that be inside the CO2 inside the bag for 30 minutes. Then you take out the bag out. By doing that, we found out that it will make the anaerobic condition in the food for and it just stop the growth of the bacteria. And as I have shown in the photograph, let's see if I can share it in my computer. Mm, like and we found out that doing this way uh, we find out that the food was like this, and putting on the bag and putting on the CO2 through the tank for few minutes only, it will give a very beneficial effect. And this is the effect after only 10 days. Now we are finding I am because I am out in the field, so I cannot have a new photograph, but now it got better. And initially it has very foul smell from the food. The foul smell now stop, so it is getting better.
Okay, yeah, thank you. I have a question from I have a question from Mohammed Firdaus. Thank you for the nice presentation. Why the cough was rejected after the vestibulotomy procedure?
I cannot tell that. We tried very much to take a calf near to the dam, but she regularly kick him out. And even at the night time when calf goes towards the mother, it kick. So we cannot tell how why it do not accept.
Okay, Ilayaraja, Dr. Ilayaraja has another question. If any anaerobic bacteria will grow, how
We
to
haven't
manage?
found we haven't found it because we are not maintaining an anaerobic condition for more than 30 minutes. So I don't think the anaerobic bacteria there will be plenty of the time for anaerobic bacteria to grow on that.
Okay, yeah.
Let's see. It's a test case. We can tell only after. I even with this only I cannot tell anaerobic bacteria will not grow. Let's see if it gets successful. It will be a landmark, especially for the elephant foot affection. I think we are going to do a treatment for 6 months. After 6 months, we can tell it will completely heal or not.
Okay. Next one is from Dr. Bahar Bhaviskar from Nagpur. Is there any test and treatment to identify and treat the pregnant animal infected with herpes so that the cough is delivered safely?
I do not know about this aspect. Most probably, we have found that even I have done a surveillance of ESV in like our breeding cow, and we have found that our like female or our elephant are carrying the infection, carrying the virus, ESB virus, asymptomatically. And especially with our research, also we have found that the shedding of the ESB by female is more in second half of the pregnancy. First half, we do not find much shedding, but they are shedding the even the pregnant female in second half is shedding the virus through its trunk. So I don't think it's a big issue. Even they are carrying the herpes infection, and we it will safely deliver the calf.
Okay. A question from Dr. Bauer. Where do we send the samples for EHV surveillance? What samples?
We have our own molecular lab in our setup. We collect the sample and run it immediately. Like if we are going to look on a young calf, we collect blood sample. For the ESB surveillance in the adult, we collect the trunk wash sample and look ESB on that sample.
Thank you so much, Dr. Amir. Thanks for your replying to all the questions. That helps. Yeah, I think I think there's one more question here. Maybe if you can just stand from Dr. Palnivel Rajan. Sir, CO2 incubator is essential for anaerobic bacteria culture. In this case, how is controlled growth of anaerobic bacteria?
I already tell that about that aspect. We have just started the work. We anaerobic bacteria growth or suppression of aerobic bacteria growth. We only more focus on the food. If it get better, we will be okay with that. But we do not care about much about aerobic and anaerobic bacteria.
Okay, Dr. Christopher Stami has a comment on that. Daily soaking the food for 5 to 15 minutes with antiseptic solution, example, tincture of iodine of 2% formulation will eradicate anaerobic and anaerobic bacteria and lead to healing. In addition, trimming of uncontrolled overgrowing granulation should be trimmed. Okay, yeah, that's a comment from Dr.
We have tried that several other treatment. All of that has failed. So we gone for
Okay.
for this elephant.
Okay, thank you, Dr. Amir. A wonderful presentation. Now I hand over the session to Dr. Heidi. So we are just in closing. Dr. Heidi, please.
Okay, oops. Thank you. Really appreciate all the presentations. Thank you very much, Amir. That was very interesting. Great presentation. And thank everyone for logging in and listening to the presentations. If you have more questions, please feel free to send them to us and we will share them with the presenters. And we'd be glad to continue on. We will have another webinar in February, I believe it is. It's every other month. That will be the next webinar. And so we will all keep you posted on this. And again, thank you to the presenters and also thank you to everyone who logged in to listen to the presentations. We really appreciate it. Thank you.